All right, we're the shoulder case study group, and we had a diagnosis of the rotator cuff injury. I'm Vivian.
I'm Madeline.
I'm Maddie. And I'm Mackenzie.
43-year-old John fell in a mountain biking accident that resulted in an injury to his right shoulder. He reported pain, tenderness, swelling, and a visible bump above the shoulder blade immediately after the fall. He also reported loss of mobility, strength, and a catching sensation in his shoulder. John recalled several injuries from previous falls, but this one is significantly more serious. In our diagnosis, John suffered a full tear of the supraspinatus in the rotator cuff. He can be treated with surgery to repair the tear, followed by 6 weeks of physical therapy, rest, and ice.
Based on the description of symptoms given by John to his doctor, an injury of the rotator cuff makes the most sense. According to the American Academy of Orthopedic Surgeons, common symptoms of rotator cuff injuries include pain, especially when lying on the afflicted shoulder, as well as when lifting or lowering the arm with specific movements. Weakness when lifting or rotating the arm, as well as a cracking sensation when moving the shoulder in specific ways, are also common symptoms. In John's case, all of these symptoms matched his description of the injury, however, the visible bump is not specifically stated. In some cases, the visible bump may be caused by a complete tear of the supraspinatus tendon, in which the muscle can sometimes roll up towards its muscle belly. According to a video with Dr. Kolowski, when this occurs, the remaining muscles of the rotator cuff pull the humerus up and decrease the acromial-humeral interval, or the space in between the head of the humerus and the acromion. This theoretically could cause the acromion to be pushed up and create a slight bump, also known as a high-riding shoulder. The key indicator that this may be the most accurate diagnosis is the fact that John has an extremely tough time abducting his arm, which is one of the main functions of the rotator cuff muscles. It is also important to note that there's a higher probability of rotator cuff injuries in patients over 40 years old, and in John's case, he's 43.
The rotator cuff consists of 4 important muscles: supraspinatus, infraspinatus, teres minor, and subscapularis, that provide stability to the arm. John's injury was most likely caused by a tear to the supraspinatus, which resides above the humerus and underneath the clavicle and spine of the scapula. When he fell off his bike, John most likely stretched out his arm to catch himself. This direct hit of the shoulder with an outstretched hand would cause excessive tension on the supraspinous ligament, causing it to tear. It is unsurprising that John feels extreme discomfort when lifting things at his side or above his head. The fact that he experiences a catching feeling when he moves his shoulder also makes sense when considering the role of the rotator cuff muscles. The supraspinatus muscle is designed to stabilize the shoulder and initiate abduction. Tearing it would result in the other muscles having to compensate for it, and a loss of movement and stability in the shoulder, which match John's symptoms.
John's doctor also considered 4 other potential diagnoses, the first being biceps tendinosis. Biceps tendinosis is characterized by inflammation of the tendon attached to the long end of the biceps brachii muscle. According to the American Academy of Orthopedic Surgeons, symptoms of biceps tendinosis may include pain or tenderness in the front of the shoulder that has a tendency to worsen with overhead lifting. Pain that radiates down the humerus, as well as an occasional snapping sound or sensation in the shoulder, are also included. In terms of John's case, only 2 of the 5 symptoms experienced can be explained by this diagnosis. It is also key to note that biceps tendinosis is an injury most commonly caused by overuse rather than trauma. This diagnosis also does not explain the visible bump above John's shoulder blade. The next diagnosis considered by John's doctors include a tear of the glenoid labrum. The glenoid labrum is a structure found inside the glenohumeral joint, whose main purpose is to keep the large head of the humerus inside the ball and socket joint, as well as prevent dislocations. According to the American Academy of Orthopedic Surgeons, symptoms of a labral tear include a sense of instability in the shoulder, dislocations of the shoulder, pain with overhead activities, catching of the shoulder, occasional pain at night or with daily activities, and a decreased range of motion in the shoulder. A labrum tear can also be caused by a traumatic fall on an outstretched hand or a direct blow to the shoulder, similar to John. In terms of the case study, a majority of John's symptoms can be explained by this diagnosis. However, once again, the visible bump still remains unexplained. John's doctors also considered a diagnosis of a shoulder dislocation. A shoulder dislocation is an extremely common diagnosis for athletes, as it can be caused by a strong and sudden forceful blow to the shoulder. Due to the fact that the shoulder is the most movable joint in the body, it is extremely susceptible to displacement, the most common being an anterior displacement in which the head of the humerus is pushed towards the front of the body. According to the Mayo Clinic, symptoms of a shoulder dislocation may include a visible deformed or displaced shoulder, swelling and bruising, intense pain, as well as an inability to move the joint. It is also key to note that the visible deformity is often characterized by a divot on the side of the shoulder rather than a bump above the shoulder blade, such as in John's case. In terms of symptoms, only 1 of 5 symptoms were met when referring to John, that being the swelling of the shoulder. The final diagnosis considered by John's doctor was a tear of the acromioclavicular ligament. A tear of the acromioclavicular ligament, also commonly known as a shoulder separation, is an extremely common injury in sports, such as it can be caused by a direct blow to the shoulder. According to the Mayo Clinic, symptoms of this type of injury include shoulder pain, shoulder weakness, shoulder bruising or swelling, limited shoulder movement, as well as a visible bump or swelling at the top of the shoulder. This bump is caused by the fact that the ligaments attaching the acromion to the clavicle no longer exist, therefore allowing the clavicle to migrate upwards and the arm to be pulled down by gravity. In terms of John's case, this diagnosis hits almost all of the symptoms experienced by John. However, the difficulty with abduction movements is not as significant with this type of injury. This injury also can include the symptoms of a catching sensation John described to his doctor. However, it would be less significant compared to the same sensation experienced with a rotator cuff injury. It is also key to note that these types of injuries are most common between the ages of 20 and 30 years old.
Regarding treatments, surgical repair is the best option to heal a tear in the rotator cuff. It can be treated non-surgically. However, those who are active and use their arms for overhead work or sports will need the surgery in order for their tear to properly heal. Different types of surgeries are available for treating a rotator cuff injury depending on the shape and size of the tear. An arthroscopic tendon repair is used for smaller tears and uses a small incision to allow a camera to be inserted into the shoulder. An open tendon repair involves a larger incision to reattach the tendon and is used for larger and more complex tears. Physical therapy is key in healing the shoulder after surgery. Rehabilitation targets the rotator cuff muscles, supraspinatus, deltoid muscle, and surrounding connective tissue. The suprascapular nerve is the most important nerve that innervates the muscles in the rotator cuff. This nerve arises from the C5 and C6 roots and comes off the upper trunk of the brachial plexus. Due to the location of the nerve, it is susceptible to injury from trauma in the rotator cuff, causing weakness, pain, and loss of function in the shoulder. The supraspinatus tendon stretches and changes the angle between the nerve and the motor branch, which causes entrapment of the nerve. Suprascapular nerve injuries are diagnosed from an EMG, CT, or an MRI. These imaging tests show compression and denervation of the nerves.
As for John's prognosis, as long as he is careful and does his physical therapy, his prognosis is good. It is common to need 6 weeks to regain mobility in the joint, although he may not be fully healed for a few months and need more physical therapy to regain strength. Now that his tendon is weakened, it will be much easier for him to injure the same shoulder, but luckily he will be able to mountain bike again because it doesn't require excessive arm movement. He'll just have to be careful to avoid any impact from falling that will cause trauma to his shoulder, because the likelihood of his supraspinatus to tear again if that happens is extremely high. What role does age play in John's injury and recovery? For starters, rotator cuff injuries are much more common in people over the age of 40 for a number of reasons. The main reason being that the blood supply to the tendons has decreased by this stage of life, so the tendons are weaker and begin to degenerate. Any trauma to the limb is much more likely to cause a serious injury such as a tear. In addition, over time, the increased use of the shoulder in general or with repetitive motions will cause inflammation in the joint from rubbing against the bones, so this will leave people with weakened tendons that are more susceptible to injury. Both of these combined leave someone like John, who is 43, a lot more susceptible to a supraspinatus tear than someone who is in their 20s. In addition to the injury, the recovery is going to be a lot longer because he's over the age of 40. This is because the lack of blood supply at this age means that the tendon will take much longer to repair because the nutrients will take a lot longer to get there to heal it completely. So while physical therapy may take 6 weeks to regain mobility in a 20-year-old and they will be fully healed by then, it'll take many more months for John to heal and gain all of his strength back.